Thanks for the introduction, Dan. So I'm going to talk today about developing a skill set in double balloon enteroscopy. I have no disclosures. Now, the traditional method in which we learn procedures endoscopically is usually through fellowship training. Usually that requires initial didactic learning and then supervised hands-on training with attendings in the program. Then, if you have a certain interest in specific procedures, you may have a mentor who teaches you further. You may do some research, publications with it, and then you go out into practice, either joining a faculty, a new institution, or private practice. For those who are already in practice, oftentimes you can learn from a partner or a colleague, or occasionally you can go to different special courses, master classes, where you can learn these procedures. Now, training for double balloon enteroscopy, however, is a little different. There are a limited number of fellowship programs that actually teach double balloon enteroscopy. And for those that do, oftentimes it comes as part of the advanced fourth-year fellowship for biliary training. So it's not available to all fellows. For those who are already in practice, there aren't that many hospitals that have double balloon enteroscopy, so you don't have the opportunity to learn on the fly. And so training opportunities for double balloon enteroscopy outside of a fellowship program are pretty limited. I think the other thing that makes it even more challenging is there's no consensus on the appropriate training for double balloon enteroscopy. So for those who want to know what they have to do, what requirements they need to practice, it's difficult to find or determine on your own. I think for those who are outside of training, it's further limit. You already have very limited opportunities for training, especially if you're not interested in a biliary fellowship. Because double balloon enteroscopy is no longer a new or novel technique, there's not a lot of urgency from other hospitals and groups to grow and train it. And I think that's even more so because the equipment is extremely expensive and the reimbursement is variable. And that in part is because there's no CPT code for you to bill. And so when people try and run the financials, it makes it difficult for hospitals to justify buying the equipment oftentimes. And so what I've been tasked in doing is explaining how you can obtain training and developing a skill set in double balloon enteroscopy when you're outside the GI fellowship. And to do so, my own story, I think, is very demonstrative of that. So I started doing double balloon enteroscopy in 2006. It came to the US in 2004. There were only, at that time, I think 6 or 8 centers that were doing double balloon enteroscopy. But fortunately, those people who were doing double balloon enteroscopy wanted to train other people. So they put out a master class from the ASGE, a 3-day class where they had didactics, hands-on training, teaching, and that's how I essentially learned how to do it. Then I had to do additional background work with it. And some way, somehow, I convinced my institution, UC Davis, to buy the equipment. There I started doing anywhere from 3 to 5 double balloon enteroscopies a week. Then I was recruited to the University of Arizona, where I started their Small Bowel Center for Imaging. And there I was doing anywhere from 5 to 7 double balloon enteroscopies a week. Then I was recruited to Florida, did 4 to 5 double balloon enteroscopies a week. And then I went into private practice. But because I enjoy double balloon enteroscopy so much, I continued to do it, even in private practice, doing 1 or 2 a week. After I generated enough revenue, didn't have any student loans or anything, I decided to go back into double balloon enteroscopy. And so I went to Cedars-Sinai, where I have a huge practice now, doing anywhere from 7 to 10 double balloon enteroscopies a week. And I think the most important thing to take from this is I actually convinced all of these institutions, except Cedars-Sinai, who already had it, to buy the double balloon enteroscopy equipment. So beyond just doing double balloon enteroscopy, I also do single balloon enteroscopy, or did it, spiral enteroscopy, Naviade, and I've even used the Pathfinder dynamic overtube, which allows you to do deep small bowel enteroscopy, or more like a push enteroscopy. So my practice has always been versed in small bowel enteroscopy, and I've done it. And I've done so All of these things I've learned outside of the training center, outside of a specific fellowship program. And I'd say with that, despite that, I think I have pretty good skills. I'm able to do unidirectional total small bowel enteroscopy pretty frequently. I mean, I can usually get to the lesion I want to. I've trained people in the fellowship programs, I've trained people, different centers around the country, and I've trained people over the world. So I have a basic idea of what's required to train people. And it's based on that that I'm going to give this lecture. So what I plan on doing today is I'll discuss how you, 3 phases for training double balloon enteroscopy. The first is the preparation for training. I'll discuss some of the background work needed, didactic requirements, then how to obtain training, what the appropriate requirements are for training, and advancing skills. And then I'll talk about developing your skills once you've actually learned it and maintaining your skill set. So one of the things that anyone who wants to take up double balloon enteroscopy should recognize is that it's a technically challenging procedure, a lot more so than any of the other procedures, colonoscopies, even ERCPs or EUSs. The enteroscope is longer, softer, more flexible, and thinner than a regular endoscope or colonoscope, so it's difficult to manipulate. The overtube adds to the complexity as it's a little cumbersome to move back and forth. And while you can do double balloon enteroscopy with 1 person, frequently it's a 2-person procedure. Now, the other thing is that you have to coordinate insufflation and deflation of the balloon while moving back and forth, inserting in and out. So it takes a lot of concentration. And then, of course, because of the length of the small bowel, the procedure takes a lot longer. So in order to do double balloon enteroscopy and be effective, you need to have competence in the basic endoscopic procedures, EGD, push enteroscopy, colonoscopy, because double balloon enteroscopy requires a variety of technical skills that you've got from these other procedures. And just because you're a good colonoscopist or biliary endoscopist or anything else, it doesn't mean you're going to be a good small bowel enteroscopist. It's a completely different field. And so in terms of criteria for training double balloon enteroscopy, the second international conference on double balloon enteroscopy, remember when we used to have that? So we don't have those anymore, but we used to back in the days. And in 2008, they came up with a basic consensus report for who should be trained for double balloon enteroscopy. And they basically stated that training should be considered by an advanced trainee only. Now, the caveat to that is they never defined what an advanced trainee is. And I think they did so to leave the door open to who could be trained. But unfortunately, I think it's led to the belief that the trainee should be enrolled in an advanced endoscopic fellowship. And they even published literature stating that. So I think what we've seen is rather than people who are generally interested in small bowel disease and deep small bowel enteroscopy, you've seen a lot more centers push it onto people who are doing advanced fellowships, biliary fellowships, and everything else, which means that the people who are doing double balloon enteroscopy now, oftentimes it's a secondary procedure to them rather than a primary procedure. So based on my experience, I have a different criteria for what I think the basic qualifications for training in small bowel enteroscopy are. I think first you need to have a mastery of basic endoscopy, which means you need to be well-versed in EGD, push enteroscopy, and colonoscopy. From a training standpoint, I think that's typically a fellow that's in their 3rd year or above. Occasionally you can get fellows who are skilled enough during the end of the 2nd year, but I think at least typically a minimum of 3rd year of fellowship. In my experience trying to train fellows who are 1st years or 2nd years, they typically get discouraged because it's too complicated for them. Because double balloon enteroscopy, when you're doing these procedures, is usually for therapeutic purposes, you need to have competence in basic therapeutics of endoscopy. And that means you need to be competent in hemostasis, polypectomy, endoscopic mucosal resection, dilation, APC ablation, foreign body retrieval, injections, and tattoos, because that's what you're going to be there for. The diagnostic test is typically the imaging or more so capsule endoscopy. You're going in there frequently for diagnosis and for therapy. The other thing I think you need is experience in reading video capsule endoscopy. Now, you don't have to be a guru in video capsule endoscopy, but in doing video capsule endoscopy, it allows you to understand and recognize some of the basic small bowel pathology, which you need if you're going to be scoping there. You also need to understand the terminology and description of the findings so you can relay that to your referring physicians, the surgeons, and everything else, so they know in medical language what you've seen and what you're doing. And then you also need to be able to understand the clinical relevance of the things that you've seen. So the first part of training for double balloon enteroscopy is you have to do your background work. You have to read, you have to learn. So the first thing you need to do, and what I did before I started doing double balloon enteroscopy, I learned the small bowel anatomy. I pulled out an atlas of anatomy, and there are plenty of them. There's Netters, there's Ferries, whatever, and review the small bowel anatomy. Also, I pulled out an anatomy textbook so I could understand more of the dynamics of the small bowel. The length of the small bowel, the length of the jejunum, the ileum, the duodenum, also the diameter of the small bowel. You know, you may think that's a minor thing, but it's actually important. One of the reasons why retrograde double balloon enteroscopy is more challenging than anterograde is not just because you're going through the colon and have to get in. It's because the ileum can be as much as a centimeter narrower than the jejunum. And so you have a narrower, smaller column in which you're trying to navigate, and that's why it can be challenging. And then the other thing is recognizing the folds, the patterns, the plicae circularis. Obviously, they're tighter and closer higher up in the duodenum and jejunum, but as you get further down, they're more distant. And you can have some areas in the ileum where you don't even see plicae circularis. That's important because it helps you gauge, based on the degree of folds, where you are. And there are very few things other than that and lymphoid hyperplasia that can help you recognize where you are or if you're in the ileum otherwise. Of course, you need to understand the indications and contraindications for double balloon enteroscopy. And now the ASGE guidelines, I think, are a very essential start to learning the indications and contraindications. Additionally, you need to learn about the adverse events associated with double balloon enteroscopy, because obviously you don't want complications, and you also need to explain those to the patients. Once again, the ASG guidelines and also the ACG guidelines are helpful with that. Then you need to understand the familiarity of small bowel disorders encountered in double balloon enteroscopy. Obviously, because that's what you're going to be referred for, that's what you're going to have to make recommendations on. And then I think one of the other key things is visualizing the procedure before you start to do it. You have to see it, you have to see people going in and out and know what the procedure is all about. Now, there are plenty of videos you can get online. Video GIE is helpful. What actually helped me, though, was the procedure manual that they had. The FUJIFILM people are probably looking at this like it's foreign, but Hinori Yamamoto, when he developed this, put out this video, a procedure manual for double balloon enteroscopy. They used to have it. They used to give it to everyone. I don't see it around very much. You should have it. You should get it if you don't have it anymore. But if you can't find that, the ASGE actually makes a very good video. They have a small bowel imaging video, and while that encompasses a lot of different other imaging techniques, they also have a very good section on double balloon enteroscopy where he gives tips and everything else. And so that's the initial background work. How do you actually do the procedure? Well, it's very limited. And so what you have to make use of the opportunities you have. And those are often the hands-on sessions. Now, the ACG has the hands-on sessions. They even have one here at this meeting Tuesday. ASGE typically has a hands-on session for double balloon enteroscopy at DDW. Occasionally, the regional courses have it. And then, of course, a course like this where you have a hands-on session here. But there are few and far courses like this in between. But what these hands-on sessions will do, it will allow you to get to understand the mechanisms of it, but while you're seeing it and you're seeing the bowel light laid out and you're insufflating, deflating the air, you can get kind of what I call the intuitive feel. Part of small bowel enteroscopy is actually getting a feel for what's going on with the scope in terms of where the body is. And you can get that feel when you're looking and observing on the hands-on procedures. You can actually see that. You see what happens when you've got air, when you're sucking in, how it collapses and everything else. And you can start to develop that intuitive feel. Now, once you actually decide to get the equipment, then this is another opportunity for learning. Obviously, when you have the double balloon enteroscopy, of course, they'll bring the hands-on equipment, and you can learn and practice that way. And then they have somebody who will instruct you and go through double balloon with you. But I've done it a number of times. I believe Danny's done it too, frequently. We've served as guest lecturers for these sites. So when places have bought the equipment, I've gone, I've given a lecture, taught the didactics, and then stood there, helped them with the hands-on course, and supervised them while they're going through patients. They usually have 2 days of endoscopy. They bring reserve 3 to 4 hours for each case, and I'll sit there and supervise them, give them hands-on instruction, teach them tips and everything else like that. And I think that's probably the best way to get initial learning of double balloon enteroscopy. Now here's the caveat. That teaches you the basics. So you know how to do the procedure, you've got an idea. But to actually be good, you have to practice. And that means you need to have a large volume of procedures. The other caveat I'd say is that even though you learn that initially, there are a number of tips and tricks that you will need. And that's where reaching out to people who are established small bowel enteroscopists, maybe going over to their center and watching for a day or two, seeing how they do procedures is another way to learn. That's what I did. I learned initially with the hands-on approach and everything else. There was nobody to give me a guest lecture for the equipment or anything else like that. So I went to other centers and I watched people do small bowel enteroscopy, and I picked up their tips, the tips that way. And I think it's important because the key to this is double balloon enteroscopy is pretty easy to learn, I'd agree, right? But it's difficult to master. And if you're trying to do it on your own without additional help, you may get frustrated. My colleagues Shabib Medizadeh and Simon Lowe did a study way back when it first came out, when they first started the procedures, in terms of time, how long it takes to do the procedures. And it took typically more than 10 to 15 procedures before the time started to decrease for the procedure on an anterograde approach and significantly longer retrograde approach. More importantly, in order to get proficient at double balloon enteroscopy, you need to do a lot of procedures. Mark Stark and Seth Groths did a study way back in 2008 looking at how many procedures it would take to be proficient, and it took more than 100 to 150 procedures before you started to be proficient. And so in order to actually be somebody who's good at double balloon enteroscopy and not just somebody who does it occasionally and flounders with it, you need to have a regular practice. And that means you need to do at least 1 to 2 cases a week. That also means you're going to need to expand your practice. And how I've typically done it, because each of those places I've been, I've had to go as a new enteroscopist and try and expand my practice base. So I've met with the local GI groups. I've met with the local hospitals. I've gone to regional hospitals, contacted the hospitals that are miles away, even in other states, and let them know that this is available. And that way you can create a good base. And once you start double balloon enteroscopy and they know that you do it, then the floodgates open up and you can't stop the business. And to give you an idea of how great a need there is for double balloon enteroscopy, this map alone should tell you everything. These are the states with double balloon enteroscopy availability. If you look, California, where I am, they have 30 sites with double balloon enteroscopy. There's 40 million people in California, though. And if you think about me, I'm in Los Angeles, 12 million people, and I'm busy every day. There's another site there's one other place that has it, a couple of other smaller places, but I'm doing 10 procedures a week, and that's at my maximum capacity. Other places, the one thing I want to highlight, if you look at the states with the white lines through them, all of those states with white lines don't have double balloon enteroscopy. 15 states. Now, yes, they may have single balloon, they may have spirus if they can find it, but I think it's pretty well established, and most of us who actually do double balloon enteroscopy and have done the other procedures know that your best opportunity at reaching your target or completing total small bowel enteroscopies with double balloon enteroscopy. And so there's a great need for it. And so for anybody who's starting out, I think there's plenty of opportunity for you to grow your practice and plenty of need. Now, one of the other things with double balloon enteroscopy, it's a very physically challenging procedure. And so if you want to do it and you do it long term, you need to be physically prepared for it. If you're like me and unfortunately you have to do 3 or 4 a day at times, it can wear you out. And so you have to take some steps to make sure you're not physically worn out, tired, or fatigued from it, or get burnout. Some of those include planning your procedures early in the day or in the midday to try and maximize the sharpness. It may be simple, but people often overlook it. Eating and resting prior to doing the procedure. And then the other thing, I stretch out before I do procedures. Before I do double balloon, I actually stretch. Sometimes I'll go and I'll do push-ups before. Not to work out, but just to get my muscles ready, because I'm going to be standing there, for 10, 12 hours a day doing procedures. And then the other thing is to maintain some kind of routine exercise so you can handle the physical challenge of the procedure. Use a padded mat, and even use those pads on the insoles of your shoes so you have extra cushion so you're not standing there all day and getting cramps in your muscles and everything. Now, a couple other caveats. In addition to the basic double balloon enteroscopy equipment, there are a number of other devices that they have. And I was surprised. Cedars-Sinai's been doing double balloon enteroscopy before I started, because Simon Lowe was one of the original people doing it. And they didn't have a lot of these accessory devices. I'm not sure everyone does or not, but I think these are extremely helpful. The foot pedal, using that to insufflate and deflate the balloon instead of using the button, time saver. Saves you from reaching, saves you from turning your neck. In addition, the picture-to-picture for insufflation. Instead of looking down at the button, seeing it right there on the screen, you know what you're doing. You're less likely to have slippage because you've got the wrong balloons up and down. Extremely important. The stiffening wire, I think that's paramount if you want to get unidirectional total small bowel enteroscopy. When I first, I have a very high rate of total unidirectional double balloon enteroscopy. But when I came to Cedars and they didn't have the stiffening wire, all of a sudden I found it challenging. And I thought, wow, I've got worse. We got the stiffening wire, I'm back in business. And so I think it's critical for getting where you are. But the caveat to that is you don't use it all the time. You have to use it, you can have it in, but you have to pull it out sometimes. There are times when the scope should be softer and time when it needs to be stiffer. And I think that's especially important. The last 30 to 40 centimeters in the ilium before you get to the cecum can be the trickiest. And those are times when you have to pull out the stiffening wire to make the scope softer, navigate around, then push it in to get through the last corner of the ileocecal valve. Using the water irrigator rather than air or even CO2 prevents from distension of the bowel. And then also using the wiggle technique to move around when you get stuck. So what do we need in terms of the future for double balloon enteroscopy? First thing we need is to improve training for people who are not in fellowship. So we need to do more of these master classes that I originally learned from. I think we need to have standardized training so people who are not in fellowship programs understand what needs to be done in order for them to learn the procedure. I think critically we need the CPT code because billing is one of the biggest issues, and understanding the cost. And I know a lot of centers that have people who do double balloon enteroscopy, but their hospital limits them to only a couple of weeks, primarily because they're not getting the reimbursement that they need. The other things, I think we need to shift our focus away from this just being a procedure to overall management of the disease process and a greater understanding of small bowel physiology. And then finally, I think we need more collaborative research amongst the small bowel centers. And I think that's one of the things that Danny's been trying to push for a while. So in summary, I think there are a number of ways of learning double balloon enteroscopy and being proficient in this procedure without necessarily having to do a fellowship program. However, it does require diligence, a lot of self-learning, including learning about the anatomy, the small bowel mucosal features, and also the associated diseases of the small bowel. I think the hands-on course are an essential way and a very important way for you actually to learn the technique and learn about it. But then it takes more. It's gonna take reaching out to established small bowel enteroscopists to try and shadow them, and then performing the procedure regularly in order to improve and get better. So that's all I have for now. Thank you very much. If anyone has any questions, I'm happy to answer them at the end of the program.